Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so excited for our topic today. So we're going to be talking about how to end the mental health stigma. Of course, this is my jam being a therapist, but I think it's applicable to everyone because I think mental health impacts all of our lives at some point, if not having a profound impact at significant moments and maybe our entire lifetime. I know that parents sometimes struggle with having a kid who has a mental health diagnosis or themselves, or society in general. Like, how do we respond to somebody else having a mental health crisis or a mental health diagnosis? And so Lauren Howard is here. She is with LBee Health, and she is going to be talking to us about her thoughts on how to impact the mental health stigma and what we can do and change about how we're handling it to better support people and our society. With that, let's get to Lauren.
Yeah, thank you so much for having me.
Yes. Okay. So I have decided, I've proclaimed that in the next, few minutes, we are going to end the mental health stigma. It's going to be over. People are going to be so welcoming and inclusive to every diagnosis. Are you ready?
So ready. I've been working at this for a while, so I think I've already got it built out.
Yeah, you did the hard work. I'm just here to talk about all the glamoury things that we have
No.
now.
Technically, you did the hard work. I just run my mouth a lot.
We're in it together. Okay, so I mean, for real, why in 2025 are we still struggling with stigmas about mental health? What do you think is contributing to that?
It there's probably 10,000 things that are contributing to it. I think in a lot of ways it's better, in that it's no longer I don't think everybody, and I don't like this word, but I don't think as many people, if you say I have a mental illness or I've been depressed or I'm dealing with depression or anxiety, they don't automatically assume that you're crazy. And I don't like that word, but that's,
Yes.
that's kind of the vibe, right? And that was always the thing. And so I think that part is kind of incrementally getting better. But I also think we have yet to really internalize and externalize to everybody else that mental illnesses are diseases, and like very few people are giving you side eye for having diabetes, right? They're just like, oh, well, there's medicine for that, and that's something you go to the doctor for. Like bodies break and brains break too, and that's a brain is an organ, and there are things that happen that cause brains not to work. I don't even want to say correctly, but not to work optimally. Let's say it that way. And so I think we probably have not done enough to, and not for lack of trying, but it just hasn't proliferated enough that these are diseases, and there's no like hierarchy of diseases that makes things more disease or not, right? Like obviously if you have something that is terminal, we're gonna treat that first, right? That's a big deal. Something that could immediately kill you, we are going to treat that first. That's a big deal. But we also I don't think we have the language to understand that like mental illness can be in some ways terminal, right? Like they can be that severe. And then the other thing, and this is gonna make people mad, but that's kind of like my jam. I don't think we spend enough time talking about the overlap between mental illness and substance use, and also the fact that they often exist independent of each other. And I'm primarily focused on the substance use there. We don't have a ton of good research that tells us that there's a link between, or a pervasive link between mental illness and substance use, meaning like if this person didn't have mental illness, they would not be using substances. We know they antagonize each other,
Sure.
but we have, we talk a lot about a suicide epidemic, and that's true. That's awful. We do have people who are attempting or dying by suicide. And we also never have the conversation about whether they were intoxicated or using substances at the time. And we don't talk about the fact that like 50% of those actions are related to substance use. So like, is it still awful? Yes. But is our suicide epidemic truly that? Or are we talking about like something that's getting massive interference from something else that we're not addressing, or that is not much harder to address, but is equally hard to address? Yeah. So I think that's where a lot of it comes from is it's so hard. It's really hard to make progress in any medical field, but specifically in this field where we spend a lot of time talking about the touchy-feely parts of it, which are very valid and very important. We don't spend enough time talking about the medical parts of it. And then on top of it, there's this narrative that, well, if you just go talk to somebody, you'll probably get better. And that might be true, but also there might be things that you have to change to get the improvement that you're hoping for, whether it's through medication, whether it's through changing behaviors, whether it's going to 12-step meetings. Like there's so many things involved. And it is a misnomer to say, let's put it this way. And this is something my dad was an addiction psychiatrist. He used to say this all the time. You cannot diagnose a mental illness while somebody is using substances. And so like with the way that substance use has escalated in the last decade, I mean, it's always been bad, but it's been really bad in the last decade and more than that. It's so hard to kind of extricate the two that it's like, it's almost like we're constantly dealing with the chicken or egg issue. And that makes it so hard to not only make progress, but then make the progress that helps people undo the stigma that is globally associated with these things. So that was a very complicated answer.
Yeah. No, but I think it's interesting. You're pulling up a lot of interesting points to me of, I think, when I think about, I don't treat addictions outrightly, obviously identifying them and saying, here, let's pass you along to somebody who is more
Right.
knowledgeable about this, because, that's one of my boundaries. I just am not I know enough to be dangerous, I think, right? In terms of substances, of like, I should not be the provider for that, but I can support you getting to those people. But I think I don't really think about people who have an addiction without mental health behind that. Is that something that does happen often?
Yes
Like a
and
mental health?
no.
Yeah, sorry.
Yeah. So yes and no. Like I ran an addiction clinic for 10 years. I have worked with a whole lot of patients, and I'll say this over and over. I'm not a clinician. I'm the administrator. I'm the one who makes sure that the clinicians have what they need to treat their patients. But also, have I seen a lot of patients who get sober and then need no mental health treatment? Absolutely. Have I seen a lot of patients who get sober and then have these new feelings that they have to deal with in mental health treatment? Have also seen that. There are a lot of people who should be going to therapy as part of their getting sober journey, and that's addiction treatment. It's not traditional, what we would consider, co-occurring disorders treatment. Like it's for addiction. So again, it's kind of a chicken or egg thing. I have seen people who have never felt depressed a day in their life stop drinking or using drugs and all of a sudden go to a deep depression because they really feel like they've lost their best friend. And that's a valid feeling. And so I would not say by any means that we see a 100% incidence rate of somebody with substance use issues also having a mental illness. Can they antagonize each other? Can they irritate each other? Can you make worse decisions on either end because of the other. Absolutely. But it also, like, you can't make a diagnosis of a mental illness or of a mental illness being the primary issue, let's put it that way, when someone's got other stuff in their system that could be precipitating a mental illness. And that was one of, I mean, we used to see patients like that all the time who would come in and say, when I stop being depressed, I'll stop drinking a gallon of vodka a day. And you're like, it's not safe to put medication in your body now anyway.
Mhm.
And so, like, what are we going to do with that? And that is a real challenge in mental health treatment in general. Is um you see, there are a lot of people who go to treatment thinking that they're going to fix their depression or their anxiety, and then they're going to wake up that morning and not want to drink anymore. And you're like, that's not how these things usually work. Are there people who have done that? Probably. Maybe, sure, but that's not generally the progression. And so the point of that being, like, it's really hard to overcome stigma when treating it can be that difficult, because we don't know which way is up and where different things are coming from.
Yeah. So it sounds like there's just so much to be known too. And also, just like as a profession, we're still learning, we're still doing research, we're still collecting data. And so we don't have all the information, as like we might understand diabetes really well, but we've been studying it specifically for longer, or, a particular type of cancer. We may have been studying, like, lots of resources are being put towards that to study it. And I think what I heard you say is also, it's like education, right? Of like, it's not that easy. So like, even for family, right? So it's like to remove the stigma. So to have somebody who's using substances, maybe is suicidal, maybe has anxiety, right? Like may have these comorbidities that are going on, that it's hard when, as like people who love these people, we don't get it. And then to be the person who's experiencing it, they may not get it. And then to be clinicians who are trying to like figure it out to help this person help themselves, like, right? Like if we don't all understand it, then it's hard as a society to reduce the stigma, because we don't even understand maybe what damage we're potentially doing, or how it even looks, or when is it like lack of willpower, when is it you need to take medication, when is it you should have a sick day for this. It, like, you're not actually sick, you just and I say that in quotes, have a mental illness, right? Like that's not that big of a deal, or like suck it up, right? I think it's why are other people able to not become addicted to substances, but you do. So just like thinking about like the things that we say sometimes and the way that we think about it. So it's both, we need more research, we need knowledge to be getting out to like the general public, not just the therapists, not just the people going through an addiction or a mental health issue or emergency, right? Like having a mental health diagnosis. It's everybody understanding that there's so much more to this. Yeah, we don't blame the person who has cancer for being exhausted because they're in chemo, or that like they have permanent brain fog from treatment from that, right? Like we don't judge them based on that, but mental health is kind of like in its own category almost, but it shouldn't be. You're saying it needs to be more inclusive into health care.
Yeah, and I think you said something that's super interesting, which is that, like, well, I'm not sick, but I need a mental health day. And I think a mental health day is a sick day, right? Like if we start if and this idea that companies have mental health days specifically that you can take. So basically you have to identify that you're having a mental health day or a mental health issue and let your employer know that so you can get a day off. That's not their business. If you want to
Mhm.
disclose it, if you're in a workplace where that's safe to do, that's fine.
Mhm.
But that we have to differentiate to our employer that we need to take a mental health day as opposed to just taking a sick day or a day or being out of the office for a day,
Mhm.
because somehow mental health is valued at a different level than having the flu. Like, It's just a day. It's not a mental health day. It's a sick day. And sometimes your brain needs a sick day, and that's fine. So I think that differentiator is, I think people mean it to be nice. They mean it to be inclusive and to let you know that they recognize that mental illness is a thing, and that it might affect your performance on a, occasionally. But also, like, do you really want your HR department to be able to go into the payroll system and pull up how many mental health days you've had in the last year and make a decision on your attendance based on what they consider to be your capability to do a job because of your mental health? Like, no, that should not be included. They wouldn't make that decision if you had the flu 3 times. There's no difference. If you're going to work, if you're doing the job, if your performance is good, it shouldn't matter if you took 6 days off because you had back surgery or 6 days off because your brain needed to rest. It's the same recovery time. And then the other thing I was just kind of working through in my brain, which is something we see a lot, and it applies to the substance use part, but it also applies to just, I think, general diagnoses, or mental health diagnoses, I should say, is while there is external stigma that keeps people from getting treatment and accessing treatment in a lot of ways, there is also internalized stigma that a lot of people have based on what they perceive to be acceptable diagnoses versus not acceptable diagnoses. And I've seen this as long as I've been in this field, especially around like ADHD versus other mental health conditions, right? And I call it ADHD specifically, but I think substance use is the same. There are good, quote unquote, good, acceptable mental health diagnoses. Ones that if you were to bring up, while having a glass of wine with your friends, they would totally understand. And then there are the ones that if you said to somebody, you think they would be scared of you. And so we want to show up to the doctor's office and say, I have trouble concentrating and I'm anxious all the time. And I feel really nervous and I have no motivation at work. And some days I'm really energetic and some days I'm just exhausted. And I definitely have ADHD. And when that doctor comes back and says, that's not ADHD, that's bipolar disease or bipolar disorder, they go, oh, no, I'm not like that. No, this isn't bipolar disease. No, I'm not bipolar. I just sometimes have really good days and sometimes have really bad days, but that's ADHD. That's what ADHD is. And it's like, well, maybe it's not. But people, I won't say everybody's fine with the idea of having ADHD, but it's definitely much more normalized. When the reality is that people with bipolar disease or people with bipolar disorder are something like 10% smarter than the rest of the population. Like they tend to be more dynamic. They tend to be more creative. They can also tend to get in trouble when their symptoms aren't managed. But we're not talking about a disease that's a death sentence. But because people are so used to hearing so many negative things about it, they don't want that. And then you have to have hard conversations like, okay, but if I put you on medication for ADHD, you could get acutely worse and end up in a hospital or making bad decisions. I had a patient once start stimulants for ADHD, and I'm not saying that that's not the appropriate treatment. Lots of people who are on them, lots of people who need them, but he was one of those people who thought that, and his doctor thought that too. And this was before he got to us, but he was put on stimulants for ADHD and then went and wrecked 3 cars that weekend and spent $80,000. I don't know where he got $80,000, but he spent $80,000 after taking like his second medication. And the unfortunate reality was that he was bipolar, but ADHD and anxiety, which is ADHD, I should say, sounds a lot like bipolar disease. Or it is, or bipolar disease, I should say, sounds a lot like ADHD and anxiety in some people. And so, but people are overall more comfortable with the idea of being ADHD than they are with being bipolar. In the same way, they're more comfortable with saying that they are drinking and using substances because of these other feelings that they have than addressing the fact that they might have a substance use issue. because that's not, I have a job, I have a family, I take care of I'm not an addict. That's not me. I'm just struggling in this way, and that means that I'm doing these things. And so they put off treatment, or they prolong treatment because they go pursue what is the more palatable response. When in reality, it's like, if we just stopped making one thing worse than the other and just accepted all of these things as brains do stuff. Let's address the thing that your brain is doing. It's not better or worse than anybody else. Everybody's familiar with the idea of depression, and you kind of think that it's just like, it's a thing that happens to people. Sometimes women have babies and get a little sad afterward, right? It's just a thing that happens. When in reality, depressions can be really serious without the more quote unquote drastic side of things, like psychotic features and severe suicidal thoughts and things like that. Like, depressions can be just as serious as somebody who's going out and making really bad decisions and destroying their lives because of another condition. So a lot of the stigma comes from this idea that we have palatable mental illness and mental illness that you don't want anybody else to know about. And like, it's your business. You don't have to tell anybody about any of it. But there is not one mental illness that's better or more preferred than another. It's, my brain is doing a thing and we need to fix the thing. And there are various and sundry ways to fix the thing. You just have to be willing to fix whatever the thing is and not want it to be this other thing that sounds less bad.
Do you think that people will sometimes go to like their doctors and hide symptoms? Like they don't want a particular diagnosis, so they'll be like, I'm not going to bring that part up. Or do you think that that's more rare?
Yeah, I mean, I think that's always a thing, especially when you're talking about treatment with medication, especially if they found, you see this a lot where people have a friend who goes on a medication and they want that medication for whatever reason. And so, they present things as whatever they are. You see it a lot with substance use. People come in and say, pretty standard question, how many drinks do you have a week? Or how many drinks do you have in one sitting? And they'll say 2, and what they really mean is 10. But they also know that if I tell this doctor that I have 10 drinks every time I sit down to drink, he's not going to listen to my other complaints. And like, that might be the right thing to do in that situation, is to not worry about the other things because this person is probably destroying their liver. But I think there's a lot of sides to it. I think especially when we're talking about neurodivergence and autism spectrum and things that are on the spectrum of neurodivergence, a lot of especially women are really hesitant to talk about their symptoms because of the ways that they've been treated. And also because they've learned to normalize them to the point where they don't notice they do them anymore. And this is a thing that we see, we've developed this program for autism assessment that focuses specifically on people with femme and high masking traits, because so often women, especially women and femmes, I should say, do not realize that they are hiding things because they've gotten so good at doing it. Because when they were a kid, if they did it, they would get socially ostracized, or they would be treated poorly, or they would get bullied, or they would get yelled at by their family to just make eye contact, which is abuse, by the way. Anyway, and so we had to change the way we ask the questions to actually get the right answers out of people. Sure. We had to be super intentional about that. So a really good example of that is, there's this idea of autistic meltdowns, right? Or sensory meltdowns, where you're so overstimulated that you become inconsolable, you scream, you cry, you do erratic things, you can't control your body, you can't calm down, you can't catch your breath. They present in a lot of ways, but that's kind of an idea of them. They're starting to be called sensory assaults, which I think is a really good way to kind of coin it. But that presentation specifically is very traditionally male. So men in general do not have a problem being aggressive, loud, hyperverbal in public if that is what they are feeling, if that is their kind of their sensory response to what's happening. They might be embarrassed by it, they might be uncomfortable by the fact that they're having this reaction, but that's not always a deterrent to men, right? Or males, I should say, boys through men. If you ask a woman who has all of the same presentations as that gentleman does, if she's ever had a meltdown in public, she'll say, "Oh God, no. No, never." And you think, "Oh, well, and she doesn't get so overstimulated in public that she can't function." But if you stop and say, "Okay, have you ever had a situation where you were out in public and whatever happened was so dysregulating that you either left early or you kept it all inside until you were able to leave, and then as soon as you were in a safe space, you had a completely dysregulating meltdown where you couldn't communicate, you couldn't stop crying, you felt overwhelmed?" They go, "Oh yeah, that happens all the time." Well, those are the same thing. But she learned from kind of pack mentality that women tend to have as young women or girls, that you're going to be excluded if you show these parts of yourself. So don't do it. Wait until you're alone. So she learned, she or they, I should say, to keep it all inside, to have the meltdown, but to not show it on your face until it's time, until you're away from all of it. Whereas he didn't have to learn that because that was not the social rules that he was raised in.
Yeah.
And so whether people are deliberately misleading or leaving out symptoms because they don't want a diagnosis or they don't want to be associated with something, or they have just been so conditioned by the situations that they were in and our social structures and things like that, where they don't even realize they're answering the question untruthfully. And we see that a ton. It all works out to be basically the same thing, which is you're chasing the wrong lead.
Yeah.
Because the information you have is not the complete picture.
Sure. Well, and I find in my practice, because I mostly am seeing kids and teens, when I see kids and teens, I'll interview the parents and ask about like family history of mental health diagnoses, right? And sometimes they'll have things that they say, but oftentimes it's like, no, we've nothing diagnosed or nothing official, or no, we're pretty normal or whatever. And then as time goes on and maybe their kid gets a diagnosis, ADHD is a great example of that, or anxiety, and you'll talk about it and they're like, "Oh, yeah, that sounds a lot like me." Right. And they're like, "I just didn't know that had a name. Like, I didn't realize that's what it was." Right. So I think
Yeah,
that
we see that. I would say probably 50% of our patients who are parents come to us after their child receives a diagnosis that is somewhere on the spectrum, and then they're trying to learn the skills to help their kid, improve and develop whatever whatever they're hoping to achieve, or if they go through OT, they go through PT, they learn all of these sensory regulation techniques and things like that. As they're going through this stuff, they're like, "Oh, that? Oh." And then get to the end and feel like they've been attacked the whole time because they're like, "Well, I didn't have any idea." But like when we were kids, if an adult talked to you and you didn't respond, what would they say? "Look at me when I'm talking to you." And if you felt physically uncomfortable by doing that, you were the problem because you were disrespectful. Not they were the problem for demanding something of you that you weren't physically able to perform at that time.
Yeah.
Now we look at it differently. Now, I mean, I've caught one person ever telling my kid to look at her when she was talking to her. And the way I almost went into like full karate chop mode, because I was like, "No, we don't do that. No." But like nobody would have ever thought that was bizarre or inappropriate when we were being brought up.
Yeah.
You look at adults when they're talking to you. You should be respectful. don't talk unless you're being spoken to. Those kinds of things. And if somebody couldn't adhere to that for some reason, they were just disrespectful.
Mm-hmm.
Or there was something wrong with them, but we assumed it was their attitude, not the fact that like maybe they actually physically cannot participate in this part of the social experience and we are not asking the questions why. So we see that a ton in the adults that we see.
Yeah. I mean, because I think we just didn't know to be curious about things like why would a kid be responding that way, right? Like why are they having a quote unquote meltdown? Like what happened, right, that caused this response, instead of just being like, stop that, like, you're fine, get up, right? Like, yes, I think we've gotten more.
You're fine. That's one of my favorites. You're fine. Oh, okay.
Yeah.
Glad you decided that.
I wish it was that simple, right? Like if somebody else is
Right.
like, this is not a big deal. And then I'm like, oh, you're right. Not a big deal. Right. My body is telling me this is a big deal. But yes.
Exactly. Because you said it, that makes it so.
Yes. I want it to be that simple. Okay. So how do we start these conversations or continue these conversations about mental health in a non-judgmental and safe way? So both for people experiencing that diagnosis, but I think also for family members too, of people who have these mental health diagnoses.
I think we are at kind of an inflection point. We might have already been at the inflection point. We might be on the other side of it. I'm not sure. But of just like what we should be required to expect or required to wait for the people in our lives to catch up to, right? So we spend a lot of time talking in our programs about, well, what if this person, what if I tell somebody this, or I act the way that I am, or I act, I don't filter the way that I am, and somebody responds poorly to me.
Mm-hmm.
Well, did you hurt them? Did you somehow violate their boundaries? Did you do something that was actually inappropriate? Or do you just communicate differently than what they are used to, and they are unwilling to meet you where you are because this is just who you are?
Mm-hmm.
And if the answer is that second one, then maybe that's not your people. And if they want something from you, if they want that relationship from you, they've got some work to do.
Mm-hmm.
We put the onus on, in some ways, I don't want to use the word sick, but like we put the onus on the people who are suffering to fix the situations that are often not created by them.
Mm-hmm.
And so, do we need people to be more inquisitive and more interested and more curious about mental illness and what it means and how it impacts people and how they can help? Absolutely. But is it the responsibility of somebody who is dealing with an illness to educate the world on their illness so that those people will be nice to them?
Mm-hmm.
I don't think so. And that is not the way it has been treated historically. Historically, we've been like, well, if you want friends, if you want people to be involved in your life, you either change to be what they are or you make them understand why you're like this.
Mm-hmm.
I don't know if anybody's ever met a person with depression, but like some days they can't make themselves shower.
Mm-hmm.
Why do we think they're going to be able to educate everybody in their family on the realities of what it's like to be inside that body?
Yeah.
And so I think it's often more about finding your people and letting the other people self-select out, and then letting them opt back in when they're ready to actually do the work, than it is to convince them that there's work they need to do. Nobody's
Mm-hmm.
out here like looking for more work to do because they want to change who they are fundamentally. There's got to be an incentive. And this is something we deal with in my family a ton. We have a couple. I have a couple of family members who are very sick, for lack of a better word. And it's kind of the opposite situation where they aren't willing to do the work to make themselves safer to be in our lives. We're here. We're willing to help if they're willing to do the work, but they're not. And in the same way that if you are a person with an illness and the people in your life are not willing to do the work to make them safe for you, then that's a boundary. And you're allowed to have that boundary, and it is not on you. You can't make them safe.
Mm-hmm.
You can explain to them what the boundary is, give them the opportunity to respect it, tell them what you need from that relationship in order to continue it, but you can't make them safe. And if they're not willing to do your list of things to be safe to you, then that tells you what you need to know about whether you're going to be able to have that relationship with them right then. I say this to people all the time about protecting your heart and keeping your boundaries, because it was very, very hard for me to set the boundaries that I needed to have to protect my mental health from people who did not prioritize it, and did not respect that their behaviors were bad for it. And I used to really, really struggle with it because I felt so bad for having these strong boundaries. I felt like I was doing something wrong by having the boundaries, not that they were doing something wrong by violating it or violating them.
Mm-hmm.
And one day it just kind of hit me that I have an infinite amount of love, but a finite amount of space. And so you've got the love regardless. It's yours, whether you want it or not.
Mm-hmm.
But the space is awarded on a merit system. And you have to be safe, and you have to understand how I operate, and you have to be willing to learn, and you have to be willing to make corrections if it's not right. And I'm going to do the same for you. It's not like this is all a one-sided deal. Like, this is the reciprocal part of the relationship. But you have to be safe for me and my kids in order to get that space. And I think people think that if we aren't willing to do the work for the people in our lives to make them somehow understand our perspective, that we're being unkind to those people, when doing all the work is not a relationship.
Mm-hmm.
They have to be willing to participate, and often they're not, because they're dismissive of it, because they haven't experienced it themselves, because they came up in a time where this wasn't a thing that actually happened, or we didn't have this problem when I was a kid. Well,
Mm-hmm.
no, you did. You just ignored it, or you just called it something different, or they didn't socialize because they just didn't like people, or they were short with people because they just had a short fuse. Not that they had a crushing depression that if somebody had actually paid attention to, they would have been back to themselves and the person that they were before. It's not, they just pretended it wasn't there, or they didn't have the words for it, or they didn't have or the stigma was so bad that they would rather somebody be miserable and alone in their bedroom than go talk to somebody who could actually help.
Yeah.
And so I don't know that that's the answer that anybody wants, but I'm not a huge believer in educating people who don't want to be educated.
Yeah. Well, and I do think that there's an important piece of educating, right? Because no one can understand what you're going through if you don't give the words to it. So they can't just know. There's no way to just know. But it's also that you have to be actively listening, like being willing to take on that information, which is hard, because sometimes we don't like what people have to say. What they have to say is contrary to what we think, or how we think they should handle it, or what we think is going on. But we can't deny that person's reality. What they're experiencing is their real experience. And so I think it is also contributing to the stigma or the difficulty in talking about it, when we feel like, if I tell you that I have OCD, and it's not the hand washing kind that everybody thinks is the limit of OCD, right? That maybe I am worried about, committing some type of religious crime per se, not really a crime, but like I might do
Yeah.
something that's against God, and that then, like explaining that to somebody, it doesn't mean that you understand it, right? Like you may not ever be able to completely understand what it's like to be me, but to understand that this is what I'm going through. And so are you there to support me even in this hard time? And yes, my job is also to get skills, and my job is also to understand when I'm being, like you also need to take care of yourself. And so like you having boundaries is good, right? Like there's just a lot of different parts in this. And I think this brings up this question of like, parents, I feel like, have a role in helping to end the stigma. Educators have a role in helping to end the stigma. Mental health professionals have a role in reducing the stigma. But then also just like sometimes I think mental health professionals are better at this. But I think as a parent, just because you have a kid who has bipolar doesn't mean you understand it. You understand your kid having behaviors, right? Or an educator, I think, like sometimes when people hear, oh, this kid has ADHD, they're like, oh man, I don't want them, or whatever. They try their best. And I don't think everybody is that way, but they have an immediate thought about what that kid is going to be like, or what that person is going to be like, or what this means. So how do these different roles have a place in ending the stigma or furthering mental health?
That's a really good question. I do think it starts with education. Obviously, I think, I think we do a good job of encouraging continuing education of a bunch of different fields that focus on mental health. And, especially in education, it's really hard though, because if you see somebody who's struggling or a student who you think could use some help, it's not like you have usually ample resources right at your disposal that you could send them to. And if you determine that a student is struggling, you should be able to send them to somebody within the school district or within the institution who can help quickly. Um, and the reality is that most of that has been stripped out of a lot of schools, or they share a resource among 10 different campuses. And the next time that person's going to be on campus is not for 10 days. And, nobody asks for mental health help because they want it in a little while. Right. Like there's
Yes.
this idea that, well, we have appointments in 6 weeks. And it's like, there's nobody who does this really hard thing of asking for help who's like, sure, I can wait. It's not important. They might say that, but that's not how they feel.
Yeah.
And so in education specifically, it's really tough because if you can't take them down to the guidance office and actually have them talk to somebody who has resources and can point them in the right direction and can do more than give them a pamphlet and doesn't just call the parents and freak out the parents, even though the parents should be involved. It's so tough to be in that position because a lot of educators are really good at spotting these things in kids and also know that they basically can't do anything about it aside from call the parents. And, and then it's frustrating to say, like, why am I the one telling you this? And that's not to knock parents. I think, a lot of kids are good at hiding things from their parents, but, not every parent receives that information well. Not every administrator receives that information well. And so, I think stories of real people experiencing real things are really important. As an example, my favorite person on the planet, RFK Jr. That's irony if anybody's listening. And he's my least favorite, not my least favorite. He's like one of my least favorite people on the planet. They're fighting for the crown. Anyway, he said these things that he said about autism last week, that are so by and large not true and so reductive of this very, very rich, very diverse population, that when we have the right tools and resources for them, can look like so many different things. And so what we've been seeing in the last week is people who are coming out saying diagnosed autistic, have 2 PhDs. My special interest is bugs, so I'm the foremost expert in the country on bugs. And I turned that into a career because that's what I was interested in, but I'm also motivated and I'm smart, and yeah, I struggle socially, but I have tools for that. And is this a disability for me? Yes, but is it fully disabling? Am I unable to function in the world? No. I, shocker, pay my taxes. And so we're starting to see these like really human, really incredible stories of what autism is in adults. What is an autistic adult capable of doing? So much. So much. We're learning what high support needs autistic individuals are able to do because those stories are coming out and people are saying, you know, yes, my kid has high support needs and he's going to live at home probably for his whole life because those are his support needs, but he also has a job. He goes to his job every day and they love him at his job because he's reliable. He doesn't show up late. He does the thing. They know how to, you know, they know if they're going to change something on him, how to tell him. And he's been there for 6 years and he's doing a great job. And he pays taxes. He pays taxes. He is, by their criteria, he is a valuable, viable human being because he pays taxes, right? And so we've seen a lot of this in the postpartum depression space too, where these very prominent women are coming out and saying like, I love my children. I loved having children. I would have 10 more children if I could, but also I don't have a great recollection of the first 6 months of my kid's life because the postpartum depression was so bad that all I could do was focus on my baby and sometimes occasionally feed myself. And that was all I was capable of. And I cried all the time and I was isolated and I felt awful. And it wasn't until somebody said, "Hey, are you okay?" And I said, "No, I'm absolutely not okay." Finally, that I got help and I realized that I was not a bad mother and that in fact, all of the things I was doing made me a really great mother. And now we have better understanding of postpartum depression and better screening and better conversations about it than we had even 10 years ago. I mean, it's drastically different now. So when we make these, when we share these very human stories about what it's like to be a person with bipolar disease, what it's like to be a person who struggles with depression, what it's like to be a person with autism. And we see that all of these things can be coupled with success. All of these things can be coupled with management, with routine, with like none of these things are a death sentence. That reduces the stigma. It makes people more likely to talk about it. It makes people more likely to ask questions because, you know, we see a lot of people for our autism assessment, and not all of them are autistic. But what are they fundamentally doing? They're asking a question. The question is, why am I like this? And can you help me be better? And better is not a great word, but that's a lot of what they say. Can you make it so that my life is more comfortable for me? But what they're doing is asking a question. Why am I like this? And because they have that question, we can answer it. So it's the same thing. Why do I get really nervous before I have to go do a thing that I know I'm going to enjoy doing? Why do I worry so much about how my shirt looks when I'm going to people who I know love me and don't care how my shirt looks? Well, that sounds like social anxiety. You had the question. Let's figure out the solution. But it starts with what, like, being willing or being able to answer or ask the question, because you have seen these very human stories of people who have lived great lives, who also have this thing that you might feel is difficult for you. One quick story, because I know we're coming to the end here, but years and years ago, I left a job that was really, really bad for me. And I stayed there way longer than I should have through crushing burnout, through a really horrific environment. And I didn't tell anybody because there is no way that anybody was going to understand that this thing that was supposed to be my dream job could possibly be traumatic in the way that I was saying it was traumatic. It's just not nobody would believe me. Who would believe me? And so finally the glass broke one day and I was like, I just can't do this anymore. And as soon as it's in your head that this is done, it's done. You can't, it's done. And so once I realized that like maybe there was something else out there, I couldn't go back. And so I think within a couple of days I was out, which was not like me at all. But I didn't talk to anybody about it for the whole time because it was just me. It was only me.
Mm-hmm.
In the period that followed, I had what I felt like was all of this like potential energy built up in my body. And the only way I could think to get it out was to start writing. And so I started posting some things on LinkedIn that I was thinking about leaving my job, about what it was like being in that environment, about how bad I felt, about myself, thinking that people were going to be like, well, this is embarrassing. Why are you sharing these things on the internet? And instead, what everybody said was, not everybody, but what a lot of people said was, oh, that happened to me and I thought it was just me.
Hmm.
And I went, well, wait a minute. If this is you and it's me and it's my literal entire inbox, why was I sitting alone for 2 years thinking that I was the problem?
Mm-hmm.
But I had to say something.
Mm-hmm.
And it wasn't until I said something that I got any kind of confirmation that everybody around me went, wait, you too?
Mm-hmm.
Oh, because me. And that's where all of this, literally everything that we've built, sprung from that one decision to get validation from a bunch of internet strangers that I wasn't losing my mind and that this thing that I thought was happening was actually happening,
Mm-hmm.
and that it was happening to other people too. And so, one of the first things we do, especially when we're dealing with mental illness, is we isolate ourselves because isolation feels right. Because it's only you, couldn't be anybody else. Nobody could understand. And that isolation tells us lies about ourselves and about the situation that we're in so that we have no motivation to speak up and to ask for help. And that happens in mental illness. It happens in incredibly stressful situations. It happens in time, periods when you're being fully crushed by capitalism. It happens in all of those situations. And so creating an environment where somebody can say, oh yeah, me too. That's where you start. That's how you get people in. And they might not do it on day one. They might not ever actually let you know that it happened. They might make the decision internally and go deal with it quietly without ever telling you. But those stories and that very human part of it, to see other people like yourself,
Mm-hmm.
is where it all starts.
Yeah. Yeah. I mean, I think that's so true. I think among everything that we're experiencing, when we know we're not the only person who has experienced that thing, it's kind of like it gives us freedom to talk about it and to do something about it or to navigate through. And I think it's really hard to take the first step to saying something, but a lot of times the things that are the hardest are exactly what we need to do, right? Like we need to speak up, right? If you don't say something, even though it feels like, okay, this is going to undo everything, or they're going to think I'm ridiculous or whatever, right? By saying something, okay, they might, right? But what if they don't? And what if that opens the door to be like, oh, well, that sounds exactly like my sister, or I was reading this story about something and that, right? And then you're connecting dots because chances are, if you are not feeling right in your body or something is feeling wrong, something might be wrong, or maybe it's not the place you're supposed to be. Maybe that job is not where you're supposed to be working, even though it was what we thought was our dream job, but it was like, good until it wasn't, and then it wasn't, and it was time to go. And right, like we sometimes are afraid to listen to those things because they might mean we need to change something, and that can be incredibly scary too. Change
Yeah.
sucks, and yeah, it's so inevitable. Like it's going to happen to all of us. Yeah. Okay, so what do you think is I wanted to have you say something on workplace really quick, but I
Yeah.
think a lot of times the workplace, they say they're accepting, right? And I agree with you on, like, I don't want everybody to know how many mental health days I'm taking, right? Like, because then they might start questioning, right? Like, how capable am I, even if I'm doing my job just fine? And so that can be really hard. But like, how do you think workplaces can support mental health?
Yeah, I think that's about having open dialogues, or like having the conversation, opening those pieces of the conversation without requiring any necessary feedback, right? Like your employees don't have to tell you if they're having a mental health day or they need a mental health day, but they should know that they can take them, right?
Okay. Yeah.
They should know how to go get the accommodations that they need. You have to be really, really visible and communicative about your willingness to support them, that the programs are available, that you want them to use them, that they're not just performative programs designed to whatever. So that when they're having one of those days, they'll actually use it.
Mm-hmm.
I've said this to people when they ask, how to lead in certain situations. Like, if you want to earn an employee's trust forever, have no reaction when they tell you they're having a mental health issue. If
Mm-hmm.
they tell you that, just treat it like, okay, all right, yeah, no problem. What do you need? How can I support you? Here's the resources that we have as a company. Here's also something that I know of that I think might help. What
Mm-hmm.
do you need time off? Let me go do the paperwork for that. But it's not a, oh, I'm so sorry. It's not a big demonstrative moment. It's, I'm here if you need me. We're going to
Mm-hmm.
support you. We're going to give you all the resources. We have solutions for this already set up. We'll take care of you. We'll make sure you get the time off that you need. We'll communicate with whoever we need to make sure that they're aware that this is taking place. And then let them go take care of their health like they're going to have knee surgery.
Mm-hmm.
Because it's the same thing. Now, you can check in with them, you can reinforce them, you can let them know, like, hey, I know things feel bad right now, but I want you to hear from me that we love having you here and your job is safe and you are a part of our team. So whatever you need from us, just let us know.
Mm-hmm.
I say to my team members all the time, anything that comes out of your face is appropriate here. So whatever you need to, if you need to express something to us, do it. That's what we're here for. But it's more about making sure they know, making sure that they are aware of what resources are available and that you support them in whatever they need. I mean, it could even be, maybe it's not a mental health issue. Maybe there's some sort of family issue that they have to take care of that's overwhelming and sometimes embarrassing and difficult. And they just need to know that you've got their back and that you're going to support them through whatever a tough situation is. That's fine.
Mm-hmm.
But having resources available, having documented processes for it, knowing what they are, knowing who they can talk to, not having people scramble around trying to figure out what the process and protocol is for this,
Mm-hmm.
not having a big reaction to it, not telling anybody because it's not your business to tell anybody. You tell like the people who need to know. In some industries, if somebody discloses that to you, you have to tell somebody or you have to escalate it or document it. So that makes sense. But like, don't tell other people on the team if they need to know she's sick or they're sick. And creating an environment where they know without being told, because you've told them so many times, that I'm really struggling. I go here, I get this. Or I go to my boss and say, I know there's a process. I'm really struggling. I don't have the capacity to remember what that is. Can you send me what I need to do? Can you support me through this in whatever way? But it's not, you want to make sure they're safe. That's the human thing to do. That's not even the boss thing to do. That's the human thing to do. Are you safe? Do you need to be taken somewhere? Is there something that you need me to do immediately to keep you safe? And then beyond that, they've got the flu. And support them in that way. Check in on them just like you would if they're on day 5 of 103-degree fever.
Mm-hmm.
Remind them that they're a valued member of the team, that you can't wait for them to come back, but that they'll be there. You'll be there when they're ready. Remind them that they can have time off if they need it. And that's it. And it's really, really is like very straightforward. Just like let them know you exist and
Mm-hmm.
make sure that the things are in place before they need them.
Yeah. Yeah, I love that. I mean, I think that's sometimes something that people don't think about is the mental health aspect of like accommodations, right? And you can call in for a sick day. Like people don't have to know, but I think what gets tricky is, if your workplace says if you have so many days, then you have to document what your illness is and blah blah blah, have to go to the doctor, and right. And so I think we sometimes forget to let adults be adults, right? And that like this is their time off, and so if they use all their time off, then they have none. Right? Like that's a problem for them, but not for you, right? Like I think sometimes that is hard, but I think having an open conversation and being supportive is really helpful. Okay, so what last question is, what do you think the long-term benefit of reducing the mental health stigma would be for our society? Like how do you think it could transform?
Um, I think every time we reduce a stigma, our spaces become more inclusive. More inclusive spaces means we get better out of people. We get better work, we get better art, we get better performance in both a personal and professional way. We get to see what their brain is capable of. It will increase lifespans. It will overall reduce the medical burden that you often see medical comorbidities with mental illness because people don't take care of themselves. I think in general, reducing stigma just makes things more inclusive. It invites people into spaces where they may not have taken part of before. And then there is something within that brain that we need as a society that they can now provide because we've welcomed them in instead of pushing them out. My dad, I think I said this before, my dad was a psychiatrist, and we used to see patients come in with OCD who I don't know why, but they just seemed to carry the most shame. They used to be so ashamed of whatever they were bringing in with them. And I don't know if they thought that we would share that perspective. Obviously we don't, but they would come in and explain their symptoms and feel really embarrassed by them. And he used to look at them and say, if it weren't for people like you, we'd still be living in caves. Because we need people who are precise and focused and able to learn the nuances of things and able to zero in on something that they are focused on in order to keep innovating and making things better and learning about new things. And like that kind of precision, it's bad when it's disabling. Like, let's make it not disabling. But your brain does a kind of precision and attention to detail that mine cannot. And if it were up to me, we would still be living in caves because I am not capable of doing the things that your brain can. And people would leave with this like sense of lightness that they did not walk in with because somebody just told them that, yes, your brain is a little bit different. That's okay. There's like, what you provide to this world is something that other people cannot, and we need it.
Yeah.
And so I think it's this idea that there's something your brain does that nobody else's does. And that gets hidden when we make people feel like they can't belong because there's something wrong with them.
Yeah. Yeah. Well, and to emphasize what you just said about OCD, something I thought was really fascinating that I learned is, I don't know what the statistic is, but there was a study about how many people that are professional athletes that either have OCD characteristics or the diagnosis because of the need to be repetitive over and over and over to perfect. And we would be without sports. That would be so sad.
Yeah.
I mean, obviously there's lots of things that are, not living in caves is great, but like, I think
yeah, right, exactly.
Right? Like that one is like top, and then sports come somewhere down there. But but you don't think about how it is ingrained or how it can be nuanced through other things that we enjoy watching or participating in, or why somebody is really good at, hitting a golf stroke or, trying a swing so many times that like somebody like me, I'd be like, I'm bored. I'm like so over that, like done. No, thank you. right?
Done
Like,
this.
okay,
No
I
longer
did
interested.
that.
Yeah.
Let's keep going, right? And then, but then another person could hit 1,000 balls and they would be like thrilled because it just went perfect, right? Like they got 10 perfect
Yeah.
ones or whatever, right? So I think just seeing that there is value and difference too, right? We don't need to be cookie cutter. That would be so boring. But also by allowing people to know that they can be their true selves is, I mean, I want to be my true self. So I want everybody else to be able to be their true selves too. Thank you, Lauren. This has been such a great conversation. I appreciate your thoughts.
Yeah, absolutely. It was so nice to spend this time with you.
Thanks again, Lauren. That was all amazing information. I mean, I think, it's not one thing, it's a lot of things. And if each one of us is doing just a little bit of a few things to end the mental health stigma, then that is going to make the world safer for everyone. But I know sometimes we need our own motivation and for our kids, right? Making our world safer for our own kids is such an important piece. And the reality is that at some point, most people are going to experience some type of mental health emergency, crisis, experience, feelings, right? Where they need to be supported. And by reducing the stigma around mental health and eliminating it, then our kids and our society and ourselves and the people we care about are also going to be supported in that. So thank you, Lauren Howard. This was such a great conversation. I want to thank you for your time today because I know that you're busy and you have plenty of things that you can be doing. So I'm so thankful that you came to join us today. Please rate and subscribe to our show. Follow us on Facebook, Instagram, TikTok, and YouTube, and keep the emails coming with future topics for suggestions for shows to accidentalexperts@gmail.com. Have a wonderful day.
Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.